Now we're going to go ahead and do a dorsal posterior orthosis, long arm orthosis. We're going to use 1/8 aquaplast, and we're going to go ahead and place this material in the splint pan. To measure for this, what we do is 2/3 the length of the humerus of the upper arm, 2/3 the length of the forearm. We can go do that in inches and centimeters. We can do a bicep circumference and do about 80% of that, and the same thing for the distal forearm piece. So once we've done that and we've transferred those measurements onto our aquaplast, we're all ready to go. We're going to wait for this material to get opaque. One of the things that we need to take a look at here in this position is, again, just for positions of demonstration, or for purposes of demonstration, we're going to do a dorsal design or a posterior design in this position right here. We can place them in different positions if we need to, whether it be with our arm weight bearing on the table, whether it be supine on a mat table, and from that position. Other variations of this orthosis can be anterior as well. If we're going to be using it for cubital tunnel or other types of things, we'll modify the position of the elbow flexion versus elbow extension. Now we have our aquaplast. We can see how it's gotten opaque like this. We're going to do what they call the wrap and tack position. So what we're going to do is come here first. Actually, we're going to roll up our distal edge to create a smooth edge. Okay, we'll see that here. And we'll do the same thing on the proximal edge to give us a nice, clean, soft edge. Once we're done with that, we'll go down here about the forearm level and stretch that around and tack. We're going to pin and tack that there. Give a stretch. It's going to conform well to the biceps. Pull that around and tack distally, approximately. Now from that position there, we'll go ahead and roll these edges out. This will clear our medial and lateral epicondyle. It is a little posterior here, but this will give us some room within the elbow flexion crease. Because how snug this is, it's going to conform very well to our olecranon, and there's really not many reasons to actually go ahead and pad this unless there's someone who has skin issues or you might be worried about pressure areas. So we want to also, again, just be very careful around the olecranon and make sure there's a nice intimate fit and there's not too much motion. If there's going to be motion there, we may want to do either pad that, create an open design, or change it from a posterior to an anterior. While we're waiting for that to solidify, we're going to go ahead and create our cuts. We'll take the grease marker and do that on the medial and ulnar and lateral borders of the orthosis. Once the material is cooled, you can snap these apart, remove the brace, the orthosis, cut down your trim lines. We'll go ahead and refit. Begin to go ahead and strap from this position. You can use one piece if you like. And then distally, just proximal to the fold, and then what we'll do is we'll do a figure 8 strap that will crisscross along the antecubital fossa. And these straps, this Velcro, can go along the medial and lateral border of the posterior aspect of the orthosis. And there we have our long arm posterior orthosis. Now that we've completed our posterior long arm splint, what we're going to take a look at is some indications and some diagnosis that this can be utilized for. Cubital tunnel, you can either do an anterior or posterior design. A lot done anteriorly, it avoids the olecranon process. However, with this technique here you can use, it gets a nice snug fit around the olecranon. We always have to be cautious about the integument. Any precautions such as pressure areas or soft tissue issues need to be addressed before applying this. Things like medial collateral, lateral collateral ligament reconstruction, and add the other diagnosis where they might need soft tissue or joint support. Types of material that can be used: 1/8 inch easy form, 1/8 inch tailor splint. This is 1/8 inch aquaplast. You can use perforated, non-perforated materials. You're going to want a more rigid material with less conformability that's going to take more support for the larger joints to be used. And you can use either an anterior or posterior joint design with this orthosis.